Now, the cardiovascular arena. Let's talk about this work and its clinical applications to CVD. This is a study done in Oakland, California, that we and our colleagues at the West Oakland Health Center did and published in 1995. Classic study. I still like it, and I hope you do too. In this trial, we had stage 1 hypertensive individuals, 102 of them, randomly allocated to education control group. They all got conventional lifestyle modification recommendations: lose weight, eat less salt, get more exercise, and avoid stress. Second group got training in progressive muscle relaxation, at the time a commonly used relaxation technique in clinical settings. Clinical psychologists often teach it. Other physicians or health professionals often teach it. The third technique was this transcending form of meditation. Both of these groups practiced for 20 minutes twice a day, had the same instructional time, about 10 hours over 5 days. Both had similar qualifications of their instructor. And when you ask about expectancy in a questionnaire, both groups had the same expectancy. So these two groups were about as close to placebo or matching for nonspecific factors as one can do in any study, particularly in a behavioral trial. This group did not have the same time, but they had more conventional standard instructions. These are systolic changes over 3 months. No change in the conventional education group. Small change, but significant, in the relaxation group. And the Transcendental Meditation group had a much larger change, about twice as great, about minus 10 millimeters in this study. Fast forward 25 years, 11 trials have been published on meditation and blood pressure with more than 1,000 subjects. Many of these trials were sponsored by the NIH, although not all of them, some of them by the American Heart Association. All the randomized trials were collected and published in the American Journal of Hypertension by a group at the University of Kentucky. And in this analysis, on average, reductions in systolic BP were about 4 or 5 millimeters in the hypertensive subjects. Diastolic reductions were about 3 or 4 millimeters in the average of 11 randomized, controlled, published trials. Second meta-analysis, which the American Heart referred to in their consensus statement last month, was this one, which was a comparative effectiveness meta-analysis, looking at various relaxation, stress management, biofeedback, and combined therapies. Now, in this case, the authors applied rigorous selection criteria to the trials that made it into the review. So a trial had to have a strong experimental design, adequate baseline measures, adequate blinding, and at least one replication. There are a lot of one-off publications without any replication. This attempted to control for that effect. So when you look at the strong published trials in this behavioral medicine field, these techniques are not significant in reducing blood pressure. And the AHA reported that. This technique, when you apply the same criteria, is significant, remains significant in lowering blood pressure. That's why the AHA said that there's only evidence amongst mind-body practices for the Transcendental Meditation technique with current data for lowering blood pressure. Now let's move into some more clinical cardiology. This is a study of chronic angina patients, chronic CHD patients at the Veterans Hospital in Buffalo, New York, who are assigned to either add meditation or continue usual care while they're waiting for coronary artery bypass graft surgery. Actually, they waited about 8 months voluntarily for this, in this case. And they were run on the treadmill before and after their meditation course. And the results of the exercise tolerance testing showed improved exercise duration, improved maximum workload, and decreased time of STT changes. So there are electrocardiological signs, ECG signs, of reduced stress, of less stress-induced myocardial ischemia, as well as improved functional measures that would go along with reduced myocardial ischemia. Well, that wasn't enough for our group and a university in Los Angeles, Charles Drew University, where we collaborated with NIH support on a study of carotid intima media thickness, arguably the best measure, the best non-invasive measure of atherosclerosis. We really couldn't send these people for angiography. We had trouble with the ethics committee for catheterization, but we could measure their carotid arteries using B-mode ultrasound. So these were hypertensive subjects who were randomly assigned again to meditation or to a matched health education class. Same time, same expectancy, same attention. And then we measured carotid IMT before and after the study. And here you show reduced carotid wall thickness in the experimentals, relative increase in the controls, which is consistent with the natural history of this disease over about a year's time. This is the first time that it was shown that with a mind-body intervention, one could have effects consistent with regressing coronary artery disease. Without changes in lifestyle, we know intensive lifestyle has its effects. Certainly, drugs used in secondary prevention have their effects, statins have their effects. But here, no drugs, no change in lifestyle. People were using their minds, managing their minds only, and having these effects on atherosclerosis. Very relevant to stroke, as well as coronary heart disease.